My name is Eric Alvarez, and I will be giving a persuasive speech on policy change. This is my audience today. 130 people every day. That is the number of lives lost by suicide per day in the United States. According to Trilliant Health's 2026 Behavioral Health Report, an estimated 20,000 people visit the emergency room for mental health crisis per day. Another 130 lose their lives by suicide. Think about that. Over a year, that is 7.3 million documented emergency room visits for mental health, and sadly, nearly 48,000 documented suicides in the United States per year. That is 48,000 friends, family, parents, children, and loved ones whose lives were lost. Through my research, I was able to find evidence from healthcare websites and government reports that millions of Americans go without mental health treatment due to costs and availability. The United States should establish a universal mental health care system that all Americans can access when needed. I'm going to discuss the problem and solutions to establishing a universal mental health care system in the United States. The problem is that many Americans cannot afford mental health services, and even those who can often face inadequate insurance coverage. As a result, millions of people go without treatment, causing mental health conditions to worsen and increase the risk of crises, hospitalization, homelessness, substance abuse, and even suicide. According to a 2025 Mental Health America report by Maddie Reinhardt and Teresa Wynn, nearly 60 million adults have experienced a mental health illness in 2024. In addition, 2.8 million youth between the ages of 12 and 17 experienced a major depressive episode with severe impairment, meaning it severely impacts their daily lives at school, at work, and at home. Many of these adults and youth are uninsured or are unable to access mental health services. Due to the costs involved in therapy and other mental health services, millions go untreated every year. This affects much more than just the individual with the mental illness. Families as a whole struggle to support those with mental illness who are unable to get services, and communities bear the cost of emergency room visits and homelessness. When people can receive early intervention, it can help alleviate the higher cost of treatment when situations worsen. The solution is to establish a universal program that allows access to all Americans, regardless of income and insurance status. Researchers from Tufts Medical Center reported that across the globe, they have found over 400 mental health interventions that were cost saving or highly cost effective, totaling less than 1% of a country's gross domestic product. By ensuring that mental health is affordable and accessible in the U.S., more Americans could receive intervention and treatment before their condition escalates to a crisis level. A universal mental health care system would also expand preventative care. Rather than waiting until someone experiences a severe mental health crisis, individuals could receive regular therapy and support services at an earlier stage. Early treatment has been shown to improve outcomes for conditions such as depression, anxiety, and post traumatic stress disorder. By focusing on prevention and early intervention, the healthcare system could reduce emergency room visits and improve overall quality of life for millions of Americans. Imagine an America where everyone has access to efficient and affordable mental health services, a place where the young and old, the rich and poor, everyone can afford therapy and intervention services before reaching a crisis point. Those struggling with a mental illness would have access to support long before their condition escalates to an emergency crisis. Those struggling with financial hardship would no longer have to choose between necessities and treatment. By establishing a universal mental health care system, the U.S. could begin building better communities and stronger families. To achieve this future, we must act. We can support organizations such as the National Alliance on Mental Illness. Visit NAMI.org to learn more and contact your local, state, and federal representatives to advocate for access to affordable mental health care. Mental health care should not be a privilege only to those who can afford it. It should be a right for everyone, as it affects us all as a community. Be the voice for those 130 people today and let everyone know that they are not alone. Thank you.